Inflammation is one of the four root causes of all chronic diseases. This is the way we look at things in functional medicine. In conventional medicine, we're very concerned with what the problem is. In functional medicine, we're concerned more with the root causes and why the disease is happening in the first place. A biggie is inflammation. As a matter of fact, every chronic disease that develops in your 40s and beyond has inflammation as one of the root causes. It's that important. So, why are we so inflamed? Well, first and foremost, it's definitely our food. If you look back at what our great, and add a few more greats grandparents ate, they ate a much less inflammatory diet than we did. They got omega-3s in their diet a lot better than we did, and a lot less omega-6s in their diet naturally. We need both, but omega-3s are anti-inflammatory and omega-6s are pro-inflammatory. This was balanced naturally back in the Stone Age. Now, in the standard American diet, the natural ratio of omega-6s to omega-3s is going to be like 25 to 1. 25 pro-inflammatory to 1 anti-inflammatory. So the food is a big source of our inflammation. What can you do differently in your diet to combat this? Well, you can decrease your intake of seed oils. That is a first big step that will lower your omega-6s. You can also increase your omega-3s in your diet. This is done by ingesting fatty fishes like salmon and mackerel and sardines and anchovies, chia seeds, flax seeds, edamame, lots of good sources of omega-3s. In addition to eating it in my diet, I also supplement with daily omegas. This is a omega 3 fish oil, and you need to look at the content of DHA and EPA in a fish oil supplement. That's the most important part. And you also want to make sure when you're picking supplements, you're getting high quality supplements that are NSF certified so that you know that what's on the label is what's actually in the supplement, and there's no extra additives, fillers, and junk in there too. So my daily omegas are great. One pill twice per day is going to be helpful in shifting your omega-3 to omega-6 ratio. So food is one source. Another source is the gut. The bacteria that are living in the gut can be highly inflammatory. So finding out who's living in the gut can be very helpful. We're going to talk more about that next week. But another thing that I look at when I'm trying to optimize inflammation for my patients is their hormones. And balancing hormones with bioidentical natural topical estrogen can be very anti-inflammatory. And you have to be cautious because using synthetic oral hormones can have the opposite effect. That can be very pro-inflammatory. And if we're trying to shift this ratio to less inflammation, you want to make sure if you're using hormones, they're the appropriate ones. A great assessment of inflammation is looking at something called high sensitivity C-reactive protein. This is a very simple blood test that can be done at any doctor's office. Ask your doctor next time you're in for a blood draw or a physical exam. A normal result's going to be less than 3. And optimal result's going to be less than 1. And the lower, the better. I strive to keep mine less than 0.3. And I do this by modifying my diet, supplementing, balancing my hormones. All of these things add up to less inflammation, which leads to feeling great now and less chronic disease in the future.